As you guys know, I'm a dentist that specializes further into orthodontics, and now I don't really do general dentistry anymore, and that goes from crowns, root canals, everything in between. And so when I saw this video pop up, I thought it would be really fun and educational to see somebody like an endodontist or a dentist do a full root canal and crown procedure and show you the exact process that you go through when you have something like this done, because it's actually super interesting. And even though I don't do these anymore, I still find them so fascinating because it's basically like art, and I think you guys will really appreciate seeing it all the way through. So me and you are going to react to the full video together, and it's going to be super fun. So let's go ahead and get into it.
6 years ago, this patient came in, and we let him know about this cavity that you can kind of see on the x-ray that was from them, and that you can see as a dark shadow underneath this filling. Then finally the decay made it down to this canal where the nerve of the tooth lies.
Now that shows you just how quick and easy you can have that decay get even bigger and wider all the way down there. A cavity may start small, but it can progress really rapidly, and you can see how massively that just ate away his tooth in just a little bit of time. I mean, this happened over from 2017 to 2022, so that was over 5 years, but still, it's not something you want to let just progress over time. Take care of it when it's small, and then you won't ever have to worry about it again.
To save it, it needs a root canal and a crown, whether it's causing pain or not. The root canal to take out the dying nerve, and the crown to prevent it from breaking.
So that's what he's doing right now, is he's taking out the nerve there with that.
And at this first appointment, we are going to do a root canal. To start, we put this rubber barrier or dam on the tooth. The rubber barrier is made to isolate the tooth, so what is in your mouth doesn't get in the tooth while doing the root canal, and what is in your tooth doesn't get in your mouth.
And when I tell you these are annoying to place, I mean, they're kind of satisfying too, but usually these little hole punches, and you punch out all the teeth, and then you use this clamp to open it up, and then normally you can pop it over all the other teeth. It looks like he's doing a single rubber dam treatment where he's only doing the one hole on that one tooth, so everything else is hidden away. And that's because we don't want bacteria, we don't want stuff, we don't get nastiness to get in there and affect the area we're trying to keep clean, because we're trying to take the infection out, not let it continue to be infected.
Once the barrier is on, the next step is to make an opening in the tooth's upper portion.
So now he's drilling up in there. He's using what we call a diamond burr.
We call this hole an access opening because this gives us access to the canals we will see in just a moment. The access opening needs to be wide enough to gain access to every canal in the tooth and remove all the decay. If it's too wide, the tooth can become excessively weakened by this opening and fracture if the opening is too broad.
And it can get really big.
In fact, that is the reason for needing a crown in the first place after a root canal. The crown, you'll see, will sit around the tooth and prevent it from breaking.
Now this is really interesting because you're seeing the red stuff, we'll call it red stuff, come out of the tooth, and that means that you have gone down into the pulp or the nerve of the tooth. Now normally when you're doing a cavity filling, there is no red stuff, and that's because you're staying away from the nerve, but his has gotten so deep that he needs a root canal because it's all the way inside the nerve, and so you're seeing that redness.
In this case, this tooth has so much decay. As you will see, that opening is quite large for this tooth.
However, so he's cleaning that out. Oh no, he's actually injecting into it. That's insane.
Quite big. And the opening for this tooth is pretty big for this size of a tooth. Now something that you might see here is this mushy consistency coming out. That mushiness or flakiness is decay when it comes out when using my slow speed hand piece drill.
It's actually the consistency of cottage cheese, or like a kind of a hard, dry aged cheese. It just kind of flakes off. Normal healthy enamel is very smooth and glassy, so that's how we can tell the difference when we're drilling into your teeth. Okay, so now that we've done the opening, he's gonna start filing now and going in with these rotary files.
Canals will present themselves as small holes in the tooth's floor. We find the holes using a long pointy metal instrument called an endo explorer. When you find a canal, this tip will slightly stick in the canal, and when you try and pull it out, you'll feel that kind of tug back or stickiness.
Yeah, man, this thing is going crazy. It must be really infected to be able to go that craziness. And what he's trying to say is, so the first thing is to initially get the top of the tooth out, and now we need to clean down inside the roots of the teeth, where all of that nerve goes down in, because that's the root, is the root canal. That's why we're doing the cleaning of the root canal.
All the canals can be quite challenging, as these canals constrict and calcify and become smaller in time. So especially for older patients, these canals can become really small.
Okay, now that they've gotten the nastiness out of there, now we're going to go ahead and start cleaning the inside and really shaping and smoothing out the walls of the canal.
If this blood supply in the center of the tooth dies, your body has no way to fight infection, so infection will easily get into these canals. So the reason we're doing a root canal is because infection got into them, And now, to prevent it from coming back, we have to seal off the canals from future bacteria.
And fun fact, he's actually using bleach there to go ahead and clean out those. You saw him injecting those little bleach area there.
Mechanical files that you've seen. Sometimes the nerve from the tooth wraps around the file instead of getting torn into shreds. This nerve here, we won't be able to see it because it gets torn into shreds while I'm cleaning out the central canal and the nerve.
Oh, he's still cleaning.
In another video, I show the nerve getting pulled out of the root canal. Sometimes we get lucky and the nerve comes out as a whole, and it's one of the joys, I guess, of being a dentist.
I love how he says this is one of the joys, like seeing this like stringy nerve get pulled out of a root. It is pretty wild when the full root comes out all in one piece. It's kind of like, it's a little trophy.
Once we clean and shape the canal.
All right, so now he's going in with these hand files, and the hand files are actually what he's using to kind of really get in there. And this is that bleach I was talking about. This is actually bleach he's putting in there.
This can even make a burning sensation. So after we filed and cleaned all of the bacteria out of the canals, we are then ready to seal off the
gutta
tooth.
percha.
To seal off the canals, we use these long rubber-like cones made of gutta percha.
Now, gutta percha is basically that orange stuff that you're seeing there, but it's almost like silly putty in a way. So basically, you put it in there, and then you use a little heated tip to kind of sear it off and then pack it down in there, so it seals really nicely.
These cones are the same size and taper as the mechanical files we use to shape the canal.
Yeah, I guess I forgot to say, so with this gutta percha, you want to dip it in some stuff, and then what that does is kind of dissolve it a little bit, and then you kind of tap it down in the root, and what it does is it will mold that kind of silly putty-ish like thing to the exact shape of that canal.
So they should fit in the canals perfectly, just like the files you used. Before we finish, we take a quick x-ray with the cones in the tooth to confirm that they will fill the canal just how we expect.
You can see him kind of putting some pressure in there to kind of form it to the root.
Here, so we irrigate with bleach one more time to make sure the canals are clean, and then we take paper cones which dry the bleach from those canals. And then after drying them, we mix sealer and coat the canals, and also we coat the gutta percha.
So now he's gluing in that gutta percha now. So basically just an overview of what we've done so far. We've cleaned out the entire thing. We've gotten access into the pulp and cleaned out all the chambers. We flushed it with all the bleach and all those things. We used our files to shape and smooth out the stuff. And then we've dipped down the gutta percha in there to seal off. And now he's cementing the final gutta percha in. And then he'll probably heat and cut off that gutta percha from here.
After all that, we melt off the excess gutta percha and place cotton and a temporary filling in the tooth. And that's pretty much the root canal portion. When the numbness wears off, you can expect some soreness that will likely differ from any soreness that you may have.
Oh, he's getting the first gutta percha piece off.
And that soreness is due to inflammation and will probably go away in a few days. And ibuprofen normally works best in this case because it helps with the pain and the inflammation.
That's actually a really interesting thing that we learned in dental school, is that ibuprofen actually works better than opioids. So actually we don't give pain pills anymore to people. We just say give them ibuprofen, and it actually works better in the studies than any of that stuff happens. Now what you're noticing is he said he's going to put cotton and a temporary filling in there, and that's actually because we have to get the crown made and do all that type of stuff too. So you'll see all that probably coming next.
You need to be careful chewing on this tooth until the final crown is made, as it is weak and can break until you get that crown.
Yeah, it's just a little piece of cotton in there, and then now he's putting a little bit of that temporary filling material in there
to give more strength to this upper portion, since we took so much of that tooth away. Here we are at the next appointment, usually between 2 and 14 days later.
So what he did there just now, you didn't see, was he gave them an injection back here in this area that connects to this nerve, and that nerve will go all the way down here and basically numb up that whole quadrant of the mouth. So now he's going to go actually do the crown preparation of what we call, which is where you remove the tooth structure to get ready for the crown, because you can't just put a crown on top of a tooth. You actually have to take away the tooth structure to be able to replace it with another type of tooth structure, which is the crown material.
We start by removing the temporary filling from the tooth until we expose the beginning of the filled root canals. To give strength to the upper portion.
Remember, we had that cotton ball in there before, so now he's going to pull that cotton ball out
to the stronger root portion of the tooth.
There you go.
Otherwise, the crown would likely break.
And that's what the inside of it looks like. It looks kind of gunky and nasty here, but you can actually, here's a picture of what a cleaned out inside root canal looks like, and you can see the root canals themselves all cleaned out.
So we start by giving the tooth a post. If I zoom in here, you can see on the screen the top of the root.
Oh yeah, there we go. Yeah, that's great. So you can see this root canal right here like this. And his tooth had basically came off. I was trying to figure out what this was. This is actually gum tissue. And it's because the whole side of this tooth is basically gone. It's crazy how much that tooth is gone.
And I'm going to go into the canal and remove a lot of that filled canal with this long straight drill. So with this drill,
so he's putting a post in, which is a metal rod basically that will go in there and screw in there to basically become a structured portion for that filling to make it look a little bit better.
What that tooth looks like with the upper portion of the root canal drilled out. What we're doing here is I'm taking a fiber post that we will use to fill the
Okay, so they're using
portion
fiber,
of the
not
canal,
steel.
and I'm just kind of sizing it to see what size I want in the canal and upper portion of the tooth. I use fiber posts because the older metal posts commonly fracture the root over time, and these fiber posts...
Because metal can expand and
So
contract.
this post fits nice now, and we're going to bond it into place. To get a strong bond, we etch the tooth surface, then we place the bond in the tooth with this brush.
You've probably seen this etchant, and what we do is we etch the tooth. That's what that pink stuff is. You've probably seen it on braces and stuff. That's the blue gunk. And what that does is it basically kind of cures the enamel tubules to kind of open them up so that things can get in there and kind of almost like Velcro stick inside the tooth and bond to it.
Then we use a light to set that bond, as well as a chemical we use to set the bond down in the canal where the light can't reach. This next material we use is called core paste. It fills up the bulk of the tooth and also bonds the post that we are going to put in now. So you see this post fits into the canal, and we use this bulk fill, which is resin that flows around the post and fills up the majority of the missing portion of the tooth. We then used my little dental explorer to try and open any air bubbles that might have formed while we were filling it up. We do find one, and maybe you can see here where I put the explorer in, it kind of opens up one of those air bubbles. Once that air bubble is opened up, we fill that void with more of the core paste. Then we take that curing light, and this again will set the post and bulk filling into place in just a few seconds.
Now remember, this is appointment number 2. Okay, so this is the second appointment this person's gone through.
Core paste will also just kind of set on its own if the light doesn't do all of it. But the light is good to kind of get things going because we have a lot of work to do during this appointment. Now we have a stronger upper crown portion of the tooth firmly anchored to a post to the lower root portion of the tooth.
Now what you see now is he's starting the crown preparation, and that is where he's using a diamond burr to literally take off all the tooth structure we talked about to get ready for the crown.
So the next step is to drill 1.5 millimeters to 2 millimeters in every direction around the circumference of the tooth. We file the tooth down because eventually the crown is going to fill in this space we are drilling out now.
And you can see that the difference in the color there, where this is white, this is yellow, that's because this is the inner dentin layer, this is the outer enamel layer. So this is what we try and protect and try and not remove. But in a case of a crown, you got to remove it.
I am not aimlessly drilling. If you drill too much tooth structure away, the crown can become loose from time to time.
Okay, I fast forwarded it a little bit to get after that because, you know, some nastiness in there I don't want you guys to see. But this is so you can see just how small that same tooth that we just saw is after this crown preparation. But he's basically getting pretty close to done. But you can see how much he's removed away. So basically the whole outer section of the tooth is gone now.
Now this Viscostat tastes terrible, so we immediately...
So he's adding Viscostat. So Viscostat is basically something that will stop all the red stuff from coming up so he can get an impression for the final crown. Because when we want to get a crown done, we need to have an impression so we can make it exactly not only the shape that we want to, but make sure that it fits with the other teeth on top as well.
I also am checking right now to make sure there are no undercuts in the preparation and that the corners of all of the preparation are rounded. And so as I look at this tooth, it's passed all my checks.
And he's got a little crown here too. All right, so now we are doing the goopy stuff, and this is like what we call PVS or polyvinyl siloxane. It's like a really good filling material that becomes hard and stays hard for a really long time. And so it works really good to get things very good. So normally he'll probably do an initial one, and then he'll use like a lighter orange one normally to get it even better. But let's see.
I like to do this in 2 steps.
Oh, he's in 2 steps. Yeah, just like I said.
With a quick setting hard material called...
Oh, this is Blue Bite. Yeah, okay.
Then we remove the impression when it is hard.
That's that orange stuff I was talking about.
Add a more detailed impression material layer. and we snap that back into place in the mouth.
You have to be really quick because that red stuff can kind of make the impression not as good and cause air bubbles and all those things. That's why he put it around the tooth here, is to get rid of any air bubbles or anything so that you don't get that. Because if you have one tiny bubble, especially around the margin of the tooth, you're done. You got to take a whole nother impression again and deal with all that red stuff.
And then eventually we take that impression out of the mouth, and if you know what you're looking at, you can see here that it has an accurate impression of the margin.
Now when he said the margin, that is the bottom shelf of the tooth. This is what a margin of a tooth or a crown looks like. And it's really important because if that margin is off on this impression and that crown doesn't fit perfectly attached to it, that means there's a little hole there. And that means food and bacteria can get up underneath your crown and ruin the tooth all over again.
We take the shade of the tooth that we also took
Shade
before
matching,
the appointment even started.
I was going to say, you should have done this before the appointment, which I think you did.
And we send it to the lab. And the lab will take this and make a stone model of the teeth and take that shade, and they'll build a crown on top of this stone model. This will take the lab a few weeks.
I have no idea what he's doing
right now. Get that crown back. In the meantime, we have to make a temporary crown so that the patient doesn't go with this stump of a tooth exposed. To do this, we use another impression we took before we drilled the tooth down as a template. The temporary crown material fills only the impression template of the original tooth in that negative space where we drilled away.
Oh, he just added some temporary filling material in there, and then he added more inside the impression, popped it on, and then he kind of gets one thing that all connects together. And then my guess is from here he'll take a little burr and he'll polish all this up to at least get a decently, you know, solid margin sealed temporary crown.
Fill the void between what the previous tooth was and the stump that is now left behind.
That's kind of cool. I've never thought about doing that.
Actually be fashioned after the original tooth. Once we remove the impression, you can see there's a lot of excess temporary material that needs to be moved and trimmed away so that we can make this look like an acceptable tooth.
And for those that don't understand, they took that impression for the temporary before they started peeling away stuff. So that way they had the shape of the tooth before they removed it all for the crown. So they used that initial impression to make the temporary.
So we take a few minutes to trim it, smooth it out, and make sure it feels even when biting.
That little blue stuff you see on there is actually bite paper. That's what he's using to check the bite, to make sure, because if you're biting too hard on a temporary crown, it will crack in half and just fall right off. So you really want to take it out of occlusion so that you're not hitting too hard on it.
Then we dry the tooth and use temporary cement to secure the
That's
temporary
same bite
crown
paper
into place until the next appointment. Before we let the patient go for the day, we then remove the excess adhesive, which looks pretty good after we removed it, especially for a temporary crown here.
And you're bonding it up. Look at that. Looks pretty good.
Appointment. So let's now fast forward to that next appointment.
So now the third and final appointment is getting the final crown installed.
Here we are at the final appointment where we will try in the final crown. So
look at that guy.
We first
looks
have
good.
to remove that temporary crown and then clean off all the temporary cement. And here we are slipping on the final crown.
I think you can see just like how good these permanent crowns really are these days. They look so realistic compared to real teeth.
And we're checking for 5 criteria for an acceptable crown before we cement it permanently.
Got to check the margins. That's what he's doing right now.
Necessary adjustments so the crown will pass all those points. First, we check how well this crown contacts with the adjacent teeth.
Oh, I forgot about that. So that's a big part, is we want it to contact each tooth really nicely and have a nice snap. Because if you don't, food and stuff will get stuck between your teeth. You people with loose contacts know what I'm talking about. Food gets stuck between and it is miserable and it hurts really, really bad.
If floss snaps nicely through the teeth,
Floss
it
gotta
will
snap.
also likely prevent food from getting trapped between the teeth when chewing. If it's
That was the hardest thing to get done with
crown won't
crowns.
sit all the way down, so we make sure the floss snaps nicely through. You want to make sure this tooth feels like it bites evenly. If the bite feels like it hits the crown before the other natural teeth, then that crown tooth can become sore over time and even cause jaw problems.
That's one of the biggest complaints I see with people that get crowns, is if you've ever gotten a crown and then your tooth starts to really hurt the next day after getting your crown, it's almost always not a problem with the tooth, it's a problem with the crown being too high, and when you're biting on it, it will hurt. And that's actually why sometimes randomly you'll have one tooth that just hurts for a couple days and you're like, oh my god, I got a cavity, and then it just disappears. And that's actually because your teeth are literally moving it out of the way so it doesn't hit anymore. And yeah, so it's a big deal with crowns.
Fifth, we check the cosmetics. If the patient is happy with the way it looks and that the crown meets the other 4 criteria, then we're on to cementing the crown.
And then he finally cements it in and it's all good to go. So hopefully you enjoyed that journey of getting a root canal and a crown, and maybe now you appreciate your dentist a little bit more, because there is a lot of artwork and a lot of steps to something as simple as a tiny little crown. And trust me, it's a lot better than losing that tooth completely. Hope that helps, and thanks for watching. See you guys next time.